sensory functioning and pain perception. And we're going to focus on pain and very briefly two different types of sensory dysfunction. But this is something you're going to get in the other classes more than here. Let's talk about pain. Well, pain characteristics. Location. Is it cutaneous? Meaning, is it on the outside? Is it a deep pain, deep inside the body? Is it visceral, kind of focused on the organs? Is it referred pain? Meaning, when you have a heart attack, but your left arm hurts, that's not your heart. That's referred pain. When we talk about pain, we talk about quality. Is it sharp, burning, diffuse, throbbing, stabbing, aching? And we're talking about duration. Is it acute pain, meaning it comes on quickly, it doesn't last too long, or is it chronic pain? People with chronic pain, we're talking months, years, maybe a lifetime of pain. Pain is transmitted and perceived. With transmission, you have the initial signal. We've got some kind of stimuli, and the nerves are stimulated either chemically, mechanically, or thermally. The nerves then travel to the central nervous system along the type A delta fibers and the C pain fibers, where they start to make some changes within the brain, and the signal itself is changed and can be changed by the different substances that are released during the impulse transmission. This has a lot to do with the gate control theory. What is it that's happening that we can do to change the transmission along the way? And then we perceive the pain. And that is influenced and modulated by the sensory system and also by emotional involvement. The gate control theory, the classic gate control theory talks about opening the gates, closing the gates for perception of pain. But what we understand today is that we can override or modify the pain perception by sending additional messages to the brain along with the pain stimulation. These additional messages: relaxation, imagery, electrical stimulation, that's the TENS units that some people use, massage, scratching, rubbing the skin. All of those are sending messages to the brain, which can the brain can only process so much. So maybe we're overriding and overloading the brain, maybe we're not, but for whatever reason, it modifies the way pain is perceived and experienced. We can treat pain with all the things we just mentioned, the massage, the scratching, the rubbing. We can treat it with ice. We can treat it with heat. We can treat it cognitively, behaviorally, and then we can treat it with drugs. But as nurses, we need to remember that medication is only one part of treating pain. As nurses, we also must accept the person's description of their pain. We don't feel it. People, their behavior changes a lot from individual to individual. Some people are very expressive in their pain and let everybody know how much they're hurting, and other people hold it in. That doesn't mean that they're feeling less pain. It just means their behavior and how they've learned to deal with the pain is different. So we accept their description of the pain and treat it appropriately. Okay, otitis media and glaucoma. Otitis media is infection of the middle ear. And here in this picture, you can see the middle ear is the part that's right behind the eardrum, the tympanic membrane. When we talk about otitis media, we're talking about effusion. That's just a big word that means fluid in the middle ear. As you can see by this picture, the eustachian tubes in the infant on the left are more horizontal, so they aren't drained by gravity to the same extent as they are in the adult. The infant's eustachian tubes are also narrower, making it harder for the fluid to drain and making it easier for them to clog. A tube runs from each ear to the back of the throat. It drains the fluid from the middle ear. How does the fluid get there? It's normally made there. So if the tube is blocked, the fluid builds up. Acute otitis media is infection in the middle ear. There's fluid in there, there's that effusion, and that fluid has created an optimal environment for pathogens to grow, and they are, causing the infection. And these are quite often associated with upper respiratory infections. Now, otitis media with effusion means there's fluid in there, but maybe we don't have the inflammation going on. There's fluid trapped in there. This is fluid in the ear, but not necessarily infection. General manifestations: acute pain, enlarged periauricular lymph nodes. That means around the ear. The lymph nodes that are in the ear region are enlarged. Rhinorrhea. Quite often people will have a runny nose. Not always, but quite often. A fever. Impaired hearing, because you've got fluid in this ear, and it's making it hard for the tympanic membrane to move. So it's a dulled hearing. And sometimes it's associated with perforated tympanic membrane. That's a ruptured eardrum. Well, let's remember, acute otitis media is acute. There's the fluid in there. There's the inflammation in there. It's recurrent. It's more than 3 episodes in 6 months or more than 4 in a year. And we might use antibiotics for this. We've learned that we have overtreated with antibiotics in the past. So antibiotics might be a treatment, but they're not automatically the treatment. The otitis media with effusion, again, there's fluid in there, but there's not the inflammation, and that's treated now by just sitting and watching, seeing will the eustachian tubes clear up, and the fluid will come out, will drain out of the ear. Okay, glaucoma. Very briefly, is vision loss caused by optic nerve damage? And with glaucoma, there is impaired aqueous humor drainage leading to increased intraocular pressure. So the fluid is building up in that front space of the eye, that front fluid space, causing increased pressure. And remember, this is just one more case where pressure is causing problems. Pressure is causing damage. There's pressure on the nerves. There's pressure on any blood vessels that are in that area that supply the nerves. We're ending up with ischemia, and ultimately we can end up with optic nerve damage. We treat it sometimes with drugs, sometimes with surgery.